Hey there, ladies and gentlemen, and welcome to the session today. It's what I call Wednesday Wisdom. I'm Dr. Botelho. On behalf of myself, my team, I want to say welcome. If you're new to the group, happy to have you guys here with me like usual. Make sure you grab a pen, make sure you grab some paper here so you can make sure that you get plenty of information. I want you to write down things. I want you to write a few pieces of information that I'm going to be sharing with you here today. The goal is to always make sure that we present things that are actionable information in a way that helps make an impact in your life so you can move things forward. You know, one of the biggest complaints I've heard from patients over the years is how they just feel lost. And they feel lost because, you know, they're dealing with their primary and then they go to Dr. Google. And I kind of chuckle a little bit, but when I say that, you guys know it's the truth. Dr. Google is, you know, it's full of information, but honestly, most of it is utterly unhelpful. And at some point, it just becomes an absolute frustration for people. And I hear it all the time. You know, we started this Wednesday Wisdom in part because of that. You know, as a treating provider, I don't have time for things that don't work. I don't have time for strategies that really, frankly, they're just a huge waste of time. So what I aim for in practice is ultimately delivering information, education that you can impart here on these Wednesdays. It's what I call BRF, you know, better results faster. Again, BRF, better results faster. You know, it's a strategy that I aim for. It's called better results faster because the clock is ticking. At this point in time in the United States, 66% of all diabetic patients, ultimately, they're gonna pass away of a heart attack or a stroke. And if you know how diabetes has impacted my family and why I'm here, then you understand why that's so important to me. And when we talk about these things like heart attacks and the stroke scenario, certainly there are issues associated with the complications of this disease that you need to be aware of. Like there's other things like neuropathy, blindness, kidney disease. I mean, you name it, the clock really is ticking. All right, then the topic at hand for this evening. Anytime I meet a patient, they're struggling with diabetes for the first time, I'm gonna ask them a really important question, and that's, what have you been doing? What have you been doing up until this point? What have you been trying to do up until this point? And almost always they give me the same kind of answer, and that's, well, you know, doc, I've been watching my diet and I've been trying to exercise. Every person, almost every single time, and that's because in addition to the standard of care, the medications that are out there, things like metformin, the glipizide, the Januvias, all the basic pills that are out there, the standard of care, the dangling the carrot out in front of you, that's just, you're not exercising enough, that must be the problem. You just have to shave down some more calories, just cut out what you're eating, right? You just gotta do all that. That's the only thing that you could do to save yourself. And before I even dig into some of the medical literature, and I wanna show you tonight, on its face, it doesn't even make sense. Like if diet and exercise were the only thing that you needed to do to unwind this diabetes mechanism that we talk about, don't you think there'd be more successful people out there that actually could reverse their diabetes? Don't you think that every single diabetic patient would just, I don't know, like buy a treadmill and hire a personal trainer and all of a sudden just get absolutely amazing results? Some of you right now, you're like, oh my gosh, you know, I've tried doing those things. How come I didn't get results? So what I've come to find is that modern medicine lays out the problem almost like, how should I put it? It's almost like a character flaw, like it's your fault. You know, you're the reason why you're a diabetic. And like, it's like an addiction. Like it's just like you being, having a sedentary lifestyle, and then that must be the problem. What we see through patient testing, and ultimately the results that follow, it's not a character flaw. It's not that type 2 diabetes patients lack the willpower, they lack the discipline. It's not that at all. In reality, there are these things that we've talked about in our master classes, in these sessions on Wednesdays, these chemical drivers that are literally forcing your body, they're forcing your DNA to express these patterns of inflammation that actually drive diabetes. Listen, maybe I should say that a different way. There are chemicals in our environment that actually force your body to develop diabetes. They're called endocrine disruptors. It's unbelievable that now in 2024, it almost feels like it's a secret. You know, my mission is to let the cat out of the bag, and we've been talking about this for a long time. I always joke about it. I'm like one of the OGs because I've been at this for such a long period of time, if they even use that word anymore. Listen, to let everybody know what's actually happening. You can see it in paper. You could see it in the medical literature. The cool part is that if you develop a plan based on reality, the current situation, you can begin to unwind and live a diabetes-free life. It is absolutely possible, and it's awesome. We see it day in and day out in our practice. I love to see these results. I love to see patients being able to generate and actually walk away from this disease and actually work smarter, not harder. Now, I have a research article here, and it's a few years back, but not very long ago. And what it does is it lays out a 12-week program. And that 12-week program is based on exercise and an extreme calorie control. This is what modern medicine is suggesting that ultimately is going to be the most helpful for every single diabetes patient that's out there that I've ever met. They just tell you, exercise, 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 calorie restrict, calorie restrict, calorie restrict. Like, that's the only way things are going to be better. So this article that I share with you here, and again, if you guys have the opportunity, go ahead and take a look at it, but please realize I put it there for those of you that do like reading those things, but realize that's my job to do that. So that's why we do these sessions where I can kind of disseminate this information. So you don't have to read it, right? But these are things that your doctor should be talking to you about. So they took 120 people in this research study trying to achieve diabetes remission, as they call it, and put them through a program, and then they do follow-up laboratory work at the end. So within this 12-week, this extreme control with food, implementing a very specific exercise protocol, harder than most patients are ever willing to work in the first place, to be honest with you. And the results showed us this. 2 out of the initial 120 achieved partial remission. 2, just 2. 2 more achieved complete remission. The rest, no remission. That's 4 patients out of the original 120 that actually achieved some form of remission. Just 4. 4 out of 120. And it wasn't even a full remission. This is one of the studies that the standard of care that you're in right now, they get super excited about that. 4 out of 120. That comes out to a 3.33% success rate using straight exercise and straight diet to help you reverse your diabetes. And I think, the thing that I think is the most astonishing part of that article is that the researchers were really excited about it. They stated, and I quote, where is it here? And I quote in that paper, right? That these results indicated that there were a subset of obese patients with type 2 diabetes is appropriate for intensive lifestyle intervention with the aim of inducing remission. Like, oh my goodness. I don't think that's what this study indicates, right? Like, this study indicates that type 2 diabetes patients will lose, right, a large amount of body weight. Those that needed to lose a large amount of body weight has something else going on inside of their body. Something other than just a need for calorie restriction and excessive amounts of exercise. Like, I know better. I know better when I tell patients that I'm going to have them eat as much as they want to eat, as long as we figure out what they need to eat. But this particular study, they talk about extreme calorie restriction, extreme amounts of exercise. And they only got 4 out of 120, partial remission. Like, if you have large amounts of body weight to lose and you have type 2 diabetes and you're listening to this right now, this should be an absolute weight off your shoulders. The result of this study means that you're not the problem. Did you get that? It's a problem with the treatment model that's out there that's been given. If you had to do exercise harder and you had to starve yourself to get a greater degree, then you probably already would have been there. That's all you have to do. The results of the study would actually demonstrate better results. They would show that maybe there'd be a 70% reversal rate through diet and exercise intervention, right? Not 3.33%. That's clearly not the case, and it's in the medical literature, right? But that's what they're touting. The reality is the standard of care, the model that's out there that tells a diabetes patient that their disease can just be controlled or put in remission by starving themselves or exercising themselves to death. It's like a crazy person. That model, honestly, it's garbage. It's garbage results. 4 out of 120. Good Lord, I wouldn't be in private practice anymore if I only got 4 out of 120 as our clinical success rate. But that's what they expect. That's the expected success rate in this article. You don't have to take my word for it. You can take a look at the article, but 4 out of 120? I think you can do better than that. I know you can do better than that. Heck, we see it all the time in our practice. If you've never looked at what's causing your type 2 diabetes and you believe that it's just must be a diet, it must be an exercise-related problem, you're not going to see success. The modern medical system that's out there that's expecting you to see 4 out of 120, and it doesn't have to end there. You can do better. If you haven't participated in one of our diabetes master classes where I show you all of the underlying mechanisms that are out there, the root causes of type 2 diabetes and how they might actually be impacting your health, get there. Make sure you take the time. Make sure you watch that. Learn what you need to do to take back control, because don't settle for 4 out of 120. That's 3.33% success. That's all I wanted to share for you today here. And I hope you're enjoying these. Let us know in your comment section. Let us know about certain topics that you want us to cover. But that's all we'll cover here. And we'll wish you all a blessed day.